All right, let's get into it. What we're about to unpack is basically a global pharmaceutical detective story. Seriously, it's all about how this invisible, unexpected threat was found hiding in some of the most common medicines out there, and the incredible scientific race that followed to keep us all safe.
I mean, that's a pretty terrifying question, right? But it's the exact problem that regulators and scientists had to confront head on. And it set off this chain reaction that would completely change how medicines are made and tested forever. The stakes were just about as high as they get.
So here's our roadmap for this explainer. We're going to start with that first shocking discovery. Then we'll dive into the science of the chemical bad guy. After that, we'll look at the global action plan, figure out how regulators actually define a safe level, and finally, check out the smart solutions being used now to build safer medicines from the very beginning.
So, where did this whole thing even start? Well, it wasn't with some big explosion. It began with a single, quiet, and completely unexpected test result that sent massive shockwaves through the entire drug industry. It all kicked off back in July 2018. A potentially cancer-causing impurity, called NDMA for short, was found in valsartan, a blood pressure medication used by millions of people. That, of course, triggered immediate recalls. A couple months later, the problem spread to other related drugs known as the sartans. But the real bombshell dropped a year later in 2019 when that same impurity turned up in ranitidine. You probably know it as Zantac. Suddenly, this wasn't just about one class of drugs anymore. It looked like a systemic problem, and that led to even bigger recalls in 2020. And this quote from Andrew Teasdale at AstraZeneca just nails the challenge they were facing. Just when the experts thought they were getting a handle on the situation, the problem leveled up. A whole new, much more complicated type of these impurities started showing up, basically sending everyone back to square one. So to really get this, we've got to dig into the science a little bit. What in the world are these nitrosamines, and how are they ending up in our medicine cabinets?
You know, at its heart, the chemistry is like a simple but really unwanted recipe. You just need three things. First, something called a vulnerable amine. That's a common building block in a lot of drug molecules. Second, you need a nitrosating agent, which is usually nitrates, tiny impurities that can be found in lots of different materials. And third, you need acidic conditions to get the reaction going. You put those three things together under the right, or I guess wrong, conditions, and boom, you accidentally create a nitrosamine impurity.
Now, it turns out there are two types of villains in this story. At first, scientists were finding these simple little nitrosamines like NDMA. But then came the plot twist, this new class called NDSRIs. The scary thing about these is that their complex impurities actually formed from the drug's main ingredient itself. This made things way harder because now the source of the problem was the very molecule that was supposed to be helping people. So where were the ingredients for this unwanted recipe coming from? The answer was pretty much everywhere. The risks were hiding in plain sight all through the manufacturing process. It could be contaminated water or raw materials. It could be recycled solvents carrying over trace chemicals. It could even be the harmless-looking fillers in a pill or the material in a blister pack. This wasn't one single leak in the system. It was a dozen potential vulnerabilities. Okay, so when you're facing a problem this complex and this widespread, you need a plan. Global regulators like the FDA and the European Medicines Agency couldn't just play whack-a-mole with recalls. They had to get out ahead of it. And they came up with a really clear three-step action plan that every single drug manufacturer had to follow. Step 1, do a full-blown risk assessment. Go through your entire process with a fine-tooth comb and find any spot where that unwanted chemical reaction could happen. Step 2, if you find a risk, you have to do highly sensitive testing to prove whether the impurities are actually there or not. And Step 3, if your tests find nitrosamines over the safe limit, you have to report it and, most importantly, change your process to fix the problem. Simple, but incredibly powerful. This brings up a huge question, though. When you're talking about impurities that are measured in parts per billion, how do you even decide what's safe? Where do you draw the line? The entire global safety net for this is built around one single number, 1 in 100,000. But what does that actually mean for us? So here's what that 1 in 100,000 really means. It represents a lifetime cancer risk. Basically, if 100,000 people took a medicine with an impurity right at the acceptable limit every single day for 70 years, you'd expect to see no more than one extra case of cancer in that whole group. It's an incredibly cautious approach designed to protect public health, setting the threshold of negligible risk. But what do you do about all those brand new NDSRIs that nobody had ever studied before? You can't wait years for new data to come in. Well, this is where a really clever scientific tool called the CPCA comes into play. It's basically a way to predict how risky a new nitrosamine is just by looking at its chemical structure. Think of it this way. Certain parts of the molecule act like an on switch, making it more potent, while other parts act like a deactivating switch, making it less of a concern. And here's how that works. If a new nitrosamine has a lot of those on switches, it gets put into a high potency category. That means it gets a super low, super strict daily limit measured in nanograms. That's billionths of a gram. But if a molecule has strong deactivating switches, it's considered lower potency and gets a higher daily limit. This system lets regulators act fast and set a science-based safety limit for any new nitrosamine they run in. Okay, so understanding the problem and setting limits is one thing, but preventing it from ever happening again, that's the real goal. This final chapter is all about moving from just cleaning up messes to proactively designing safer medicines from scratch. So, how do you stop that unwanted chemical recipe? Well, you take away one of the key ingredients. Drug makers can now do things like add antioxidants, think vitamin C, right into the pill to block the reaction. Or they can add a base to control the pH, making the environment less acidic so the reaction just doesn't happen. And beyond that, it's all about stricter controls, testing everything that comes from suppliers and redesigning manufacturing to avoid the high heat or other conditions where these things like to form. The Zantac or ranitidine case was such an important lesson. The problem wasn't just contamination from the outside. The drug molecule itself was the issue. It was just inherently unstable. Over time, or if it got too warm, it could literally break down and form its own NDMA. It was a huge wake-up call that you have to understand a drug's stability over its entire shelf life. The pioglitazone case, on the other hand, was a textbook example of contamination. In this situation, one of those key recipe ingredients was being carried over from an earlier step in the process, maybe on equipment or in recycled solvents. It then reacted with the drug molecule later on. This just hammered home how absolutely critical good manufacturing practices are. And none of this would be possible without the real unsung hero of this entire story, advanced analytical chemistry. We are talking about incredibly sophisticated machines that can find and measure these impurities at mind-bogglingly low levels. To prove a process is truly clean, labs have to show they can detect these things at just 10% of the already tiny safety limit. It's just incredible technology. When you take a step back, this whole thing is really a remarkable story of the global health system working exactly like it's supposed to. A threat popped up, science is mobilized to figure it out, and a solid, proactive system was built to protect patients. It really marks a fundamental shift from just reacting to problems to actively designing them out of the system from the start. And that leaves us with one last, really important question for the future. Our technology is only going to get better. We're going to be able to find smaller and smaller, even more theoretical risks. So how do we navigate that? How do we keep pushing for ultimate safety while at the same time making sure that essential life-saving medicines are still available for the people who need them? That's the balance we'll always have to work to get right.